Okay, so it's preparing to live stream.
Good.
Man. Anyway, like the first, okay. I think it's gonna work.
Yeah.
Are we there?
Yes. Thank you everyone for your patience.
But unfortunately, I can't see myself.
You're
So I go back to Zoom.
Yeah.
Okay. Okay.
Thank you everyone for being a part of today's show. Welcome and sit back. Oche.
Yeah, okay.
Floor is all yours.
Good evening, everyone. I am so sorry for the late takeoff. I have always been babysat.
Oche, I'm with you, even though you can't see my face.
Okay, thank you for coming.
Let me just put light on quickly so you can see that I'm with you people. Hello.
No, as long as you're logged on, even if I'm not seeing your face, it's fine. Thank you.
Okay. I'm with the meeting.
Oh, okay. Okay, no problem. Thank you. Thank you for joining us.
Yeah.
Okay, so let me go back to my apology. I hope we're fine now, guys. Sorry for the hey, and you know the unfortunate thing is when things like this want to happen, they don't happen to you when you're by yourself. Today that my partner is here, so is here. With Fio, I can do as I like. It's not a problem. But these are people that I'm supposed to behave myself in front of.
Don't you think these are all parts of menopause?
You know, stop it. Oh, I need to remain appealing to Ndia Umunaha. I've not gotten there yet. Okay, guys, moving on. You're warmly welcome to today's show. And today's topic is living with menopause and all that it brings. Seeing this particular topic, people might think it's for ladies, but I assure you that even the men need to hear about it because it will help you to indulge your wife when necessary, to accommodate her, understand her better, and possibly run away if need be. So on board tonight, we have my very bosom friend, Fiola. Oh, I wanted to say Fiola Obi, but that can go, right? She's Fiola Obi, she's Fiola Onoha. So whichever one you choose. We had another doctor that is supposed to be here as well. He logged in early and then the network threw him out. Oh, well. I don't know if he'll be able to, I don't know if he'll be able to come back, but we just have to start. We are already late. So before I go to the question of the day, I would like to give my CLO moment. By CLO, we mean Chief Love Officer. That's what I am in Oche Kitchen. So for the CLO moment for today, it is meet people where they are, not where you want them to be. So because you can't force someone to be at a different level of maturity or readiness when it is convenient for you. So whatever it is, allow people to evolve by themselves. You will have a smoother relationship. Okay, so Phil, question number 1.
Yeah.
What are the phases and some of the common symptoms of menopause?
Okay. So thank you, Oche Kitchen, for having me. And a very big thank you to everyone that is here, particularly the guys. And I want to echo what Oje said. This is as important as it to the women as it is to the men. And like, I don't know if you heard my earlier comment. It can go a long way to saving marriages even. So it's worth listening. You might take home one tidbit or two. So I want to make menopause, this topic, as, easy to talk about as possible. All right. Because I think, yeah, I think a lot of people are actually scared of it or worried about it, embarrassed about it, and a lot of us, unfortunately, are completely ignorant about it. The first thing is that it's not an illness, okay? Owogoria is not an illness, it's a phase. And it's something that every woman is going to go through at some point. And just as at the start, when, we all started our periods, and those of us that are parents, when our daughters are now beginning to have their first periods, it's like something to celebrate. I want us to look at menopause as something similar, because it's like the end of a journey. Just like your first period was the start of a journey, the menopause is like the conclusion of that journey, okay? So in essence, it just means the last period, okay? And then just one of the questions Oche said was the phases, right? So the thing with the menopause is that it is the last period. So it is what we call a condition in hindsight. You are not officially menopausal unless the last time you had a period was more than 12 months ago. Okay, so we need to be, it's a very important fact. So some women, you might have a period, no period for like 9 months, 10 months. You're not yet officially through the menopause until it's specifically 12 months and above since your very last one. That brings me to the other part of Oche's question, the phases, okay? So there is menopause, but there's what is called the perimenopause, which is the time leading up to the menopause itself. And this time, it varies from woman to woman, okay? So just like, I don't know if you guys remember, when we were younger in boarding school, some girls had periods that were like, they would last 1 day, 2 days, and it's fine. Then you had other people that would have a week. You have people that would be doubled up in pain. Some people can't go for PE, can't go for manual labor on Fridays, while some people, you wouldn't even know that anything is up with them. So it's different for so many people. And it's the same with this menopause as well. Some people will go through it like a breeze, They'll just, the only thing different is that their periods have stopped. While some people will have a difficult time, it could last a year, 2 years, 3 years, and everything stops. Or some people will just carry on for years and years, which is a bit, unfortunate for them. So this phase, this perimenopause that starts between 5 to 10 years. So it could start as early as 40 in some people. That's why you see us joking, are you menopause and all that? That's because you're already beginning to have these symptoms, of this menopause, but you're not yet menopausal, but you're already exhibiting some of these symptoms in the time building up to this, okay? So the average age of the menopause is about 50, 51. So if you count backwards, 5 to 10 years before 50, some people will start at 40, some will start at 50, some, like I said, will have nothing at all. Okay, so that is what, what we mean by the phase, the perimenopause and the menopause itself. And then, how I said it's not an illness, it's a natural, thing. Unfortunately, there are some women that will go through menopause unnaturally. Okay, some people have what we call premature menopause, where they're going into the menopause even before they're 40. All right, so those ones need to be looked into. They need to see their doctors. They need to have tests done. Sometimes you get it following treatment like surgery, where your womb has been taken out for one reason or the other, or the ovaries were taken out for one reason or the other. Or some of us that have had to go through cancer treatments, chemotherapy, radiotherapy. So that is completely different. In this form, we're talking about the natural one, okay? So is that all right, Oche? Does that answer your question?
Yeah, it kind of answers my question, but the point where you said if somebody goes into early menopause, the person has to run some tests. So what if you run tests and they say, oh, your hormones are okay and nothing seems to be the problem? Do you still have to worry?
No. So the thing about this will now bring me to those symptoms. Okay, like I said, the main thing about menopause is that no period at all. You know, for more than 12 months, you don't need a test for that. It's what we call a clinical diagnosis. The doctor asks you, when was your last period? Oh, my last period was September 2021. It's official. Okay, you don't need any blood test to confirm that. But if you come and let's say you're aged 39, for example, and you say to the doctor, oh, my periods have been hit and miss. And they say, when was your last period? Oh, my last period was actually, wow, about September last year or something like that. It's not right. You get what I mean? Because this is a 39-year-old lady saying she has no, and the first thing they'll ask, are you pregnant? No. Are you on any contraception? No. Then they have to do those blood tests. And believe you me, those blood tests will be abnormal. It has to show something is not right. But when you have a lady that is about 45, 46, saying, oh, doctor, my periods have been hit and miss. Last one was 6 months ago. Before that, it was 3 months, this one, that one. And they run those blood tests. And like you said, all the hormone tests come back normal. Okay. That lady is not menopausal, rather she's perimenopausal. You see what I mean? So, and then the treatment for this lady would have to be based on her symptoms, okay? Because, you know, something can be done about it. So
you're talking about the perimenopausal lady?
Yes.
So she has to be placed on a kind of treatment?
It's up to her. It's up to her. I think the main thing is the lady saying what is bothering her the most, and which brings me to these symptoms of this perimenopause or menopause, okay? Like I said, it varies from woman to woman, okay? Some of them can be subtle, very, you know, little things that you may overlook or may not bother you, but some of them can be quite major and debilitating, okay, that some people struggle to cope with. So if Mrs. A is having symptoms that she's not bothered about, that's fine. Like I said, menopause is natural. But if Mrs. B has the same symptoms as Mrs. A, but she can't cope with it, then you have to, you know, there's help. There are things that can be done. You see what I mean? It varies. So for example, there are some women that are very fussed about their cycles, their periods. They have to have a period. Okay, so
to feel normal.
Yes, to them, that's what makes them a woman.
Meanwhile, some of us feel is a kind of stress.
Yeah, some women, they have painful, heavy periods and would rather do without them. Okay, so this is my point exactly. How your attitude towards it is what counts. So there are some women that will go on contraception that would mean that they would not have any periods at all, and they're happy with that. Okay, while some women will go on contraception that they won't be happy not to have periods. They'll rather have something that every month they have something to reassure them. That, you know, so like I said, it varies from person to person. So one of the key features of perimenopause and menopause is the periods, the changes in the periods. So you see a woman having regular periods every 28 days, every 30 days, suddenly she's going maybe 3 months without a period, or is getting closer and closer. Instead of 28, 30 days, she's having a period every 21 days. Okay, or she has her period usually is 3 days. Suddenly she's bleeding for 7 days. Or
all these are part of.
Yes, or somebody that has a 5-day period suddenly is bleeding for only 2 days and it's ending. I'm like, doctor, something is not right. So it didn't used to be like this, but actually, it's all part and parcel of it. But
it is that time.
Yes, but always check with the doctor, and you'll see they'll ask you certain questions, maybe run some tests if need be, and they'll say to you, Mrs. B, actually, is to be expected. Is it bothering you? Actually, I'm not bothered. Now that you say that it's normal, it's fine. I can cope with it. How long should I expect this to go on for? Or Mrs. A, no, doctor, no, I don't want this. So I don't like it. I don't like the regularity of it. I don't like it's ruining my life. It's blah, 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 blah. you know, and there are things that can be done. You can put you on certain pills that can help regulate your cycle. Okay. So like I said, it depends on what is bothering the person the most. And like I said, there are some subtle symptoms, like some women will have changes to their skin. Okay. The skin now becomes dry and not shining anymore, because you need to remember that menopause is the end. The hormones that make you a woman is now going down.
Declining.
Yes, yes. Those hormones that make us shine, that make us glitter, make our skin smooth, you know, all that whatever is now going down. Okay, things start to sag. Right? And then some people start to lose their hair. I won't mention some people's names, but you see, and then he may bother some people, but he may not bother others. Some people have a full head of hair, and losing a bit of hair makes no difference to them. But you have some people that don't have much hair and then going through this period, and then they're now losing their hair. Their hairline is receding, or their hair is getting thinner. It's a problem for them. They're not happy about it. Okay. You see people complaining about you know, body aches and pains, joint aches, and people saying, I can't even climb the stairs again. You know, it's a combination of that with definitely old age, arthritis, and the rest of them. But it varies from person to person. Mrs. A might not be bothered about it because maybe she's fit, she's slim, you know, she's fine. So a few aches and pains is not a big deal. But Mrs. B might be this big, you know, and then in addition to arthritis, now has this on top. It can be life-changing for her. Okay, so you have to address that matter. So if that is bothering Mrs. B, that has to be dealt with. If she's not bothered, you know, that's fine. But like I said, there are some major ones that can cause an issue. So things like the sweats, the flushes, you know, they can be really bad. You're just sitting down talking to somebody, and the next thing, your face is, if you are fair, pure red, you know, for no reason at all. Suddenly everybody is cold though, and then you're now sweating, fanning yourself. And like I said, this can be an issue in marriages. Like in the middle of the night, in winter, you see a woman jumping out of her bed, opening the window, turning off the heating. Meanwhile, her husband is freezing there, you know, because it's like, this woman won't kill me with this.
Is there a way to escape these flashes of a thing?
Yeah, so there is treatment for it.
Okay, we'll get to that.
Yes.
I'll give Winifred the chance to ask her own question. Winnie, are you there?
Yeah, Oche.
Okay.
So far, so good. Thanks for telling us about the common symptoms of menopause. My question is, we know that there are psychological symptoms as well.
Yeah, sure.
Expatiate on that.
Yeah, so you know how I said some will have symptoms, some won't have, you know, the main psychological ones, okay, sometimes they're sort of intertwined, all right? So there's this one called loss of libido, where the woman is just not in the mood anymore to have sex. It's a kind of psychological thing, but it could also be related to physical symptoms. You know how I said about the hormone changes and all that. It also affects the vagina, the dryness, the lubrication and all that. So when all that is less, and then someone wants to, you know, make love to you, and you know it's going to be uncomfortable, it's going to hurt you, you're not interested, she's pushing you away and all that. So this is why I said it is important that the men are aware of this. It may not be that she doesn't want it, you have to be understanding. And again, things can be done about that. So the loss of libido is a psychological thing, but it also has a physical aspect to it. You see the women having mood swings. You know, a lot of us will know what I'm talking about. Men and women alike. One morning, happy, jolly, smiling, and then the next minute, very moody, irritable for no reason whatsoever. Even you, the woman, cannot put a finger on why you're suddenly that way. You know, one minute you're happy, next minute you're crying, tearful, things that shouldn't be a problem. You just can't help yourself. Being very emotional, low in mood, depressed, anxious, things that don't bother you. Suddenly your heart is pounding. Yeah, you know, you're worried. And then
so palpitations can actually be one of the symptoms.
Yes, definitely. You know, and then the what is so perplexing about it is that you can't put a finger on why you feel that way. A lot of times you feel anxious and there's a reason for it. Oh, you're anxious about, I need to pay my bills, or you're anxious, oh, my son is going back to school tomorrow, or, but
or you have an exam.
You can't explain, yes, you can't explain why you have that feeling of doom. And then the irony is that the next morning you wake up and you're fine. And then 2 weeks later, you're feeling like that again, that, up and down. Poor sleep, insomnia. You can't sleep at night. You toss and turn. It could be due to the hot flushes. It could be due to the sweat. It could be due to the anxiety. But again, some people, they just can't sleep at night. And then it has, a follow-on. This in the next day, you're so tired, you're irritable, you can't focus at work. There's what is called brain fog, where your head is like there are cobwebs in your head. You can't shake it off. You can't concentrate. Your colleague is asking you a question. You're like, excuse me, you're drinking so much coffee just to try and wake you up and, whatever. So these are not, like I said, these are major things and can be very life-changing and causes a lot of problems for women at home with their husbands, their partners, at work, with their children, their social life. So it's not something that should be, sort of like trivialized, There should be a lot of empathy. If you have colleagues, mothers, friends, yourself, you need to be able to support one another and encourage, that this is just a phase. Things can be done about it. You can talk to someone, you can get help, and you can get through it.
When you say it's a phase, how long does it actually last?
Yeah, how long is a piece of string? Okay, that's a good question, Winnie. At the start I said, we're all different. How when we're in school, some of us had periods 2 days, 3 days. Some of us started at 10, some at 12, some 15. Okay? It is going to be different at the end of the journey as well. Some people will go through this in no time. The only thing that will change is their periods will stop and they are fine. Some people will go through these symptoms we've talked about, the hot sweats, the skin changes, the vaginal dryness, the mood swings, horrendous time for maybe a year, 2 years, and they're out of it, okay? Unfortunately, some women will go through it for years.
Like it lingers.
Yes. How do we know who? We can't tell. You can't tell if Mrs. A will be in group, the group that will have no symptoms. You can't tell if Mrs. B. It's something you have to wait out and see. Sometimes you can get a pointer if your mom's still there. All right. A lot of us take after our moms, our grandmas, maternal side of the family. You could have a chat with your mom or your grandma if she's still there. And we tend, not all of us, unfortunately, but most of us will have similar symptoms to what our moms went through. So if your mom had an early one, you're likely to have an early one. If your mom had a troublesome one, lingering years, it's likely that you would. And I'll strongly recommend
have the turbulence.
Yes, that's a good way to describe it. Yes. If you
one has to be psychologically prepared as well.
That's what I'm trying to say. That's why. So at the moment in the UK, we're having a sort of trend with menopause. It's suddenly the in thing now. People are talking about it. People are going to speak to the doctors, getting treatment. There's an awareness of it now. And the awareness is not necessary that everyone has to go on HRT. The awareness is you need to know what it is all about. You need to know what to expect. You need to know when something is not right. Okay. So even though, fine, you've not had a period for 12 months, oh yes, and then suddenly you have a period in the 15th month, that is not right. You see what I mean? So you need to know what to expect, what is not,
So it shouldn't be something to be happy about if you've had the 12-month break and somewhere along the line it comes.
If you've had no period for 12 months, and you are officially, I will give you a stamp and say, yes, Mrs. B, you're off, Mrs. A, you're officially menopausal. And then you go out and you come back 3 months later and say, hang on, doctor, I didn't have a period for 12 months. You declared me menopausal. And now 3 months later, I'm suddenly having a period. Is that normal? It is not normal. That has to be checked.
Wow.
Okay, that has to be checked. That is no longer normal. All
Hmm.
right. So
Okay.
does that answer your question, Winnie?
Yeah.
I think it does. Okay, so I'll take the next question. Give us an insight into HRT and how that can help.
Okay, so HRT, as the name implies, hormone replacement therapy. And you know how I said that it all has to do with the female
Because a lot
hormone.
of people don't even know that it exists. So we need an insight into it and then tell us how it can help.
Yeah, so like I said, it's hormone replacement therapy. So in essence, what's you know, they're trying to replace that hormone that is now decreasing in your system. Okay, it may not be able to reverse to the previous status quo, but it may go a long way to helping with some of the symptoms. One pointer, HRT, even though the hormones are similar to contraception, going on the pill and all that, it is not the same. The fact that you're on HRT doesn't mean you're protected from pregnancy. Okay.
Wow.
And remember that if you're menopausal, that means your last period was more than 12 months ago, then yes, you're not likely to get pregnant again. But if you're perimenopausal, you may still get pregnant. Okay, so be very cautious. And then if you're perimenopausal and you happen to be on HRT, which I'll come to in a minute, it does not protect you from pregnancy. So you still need to take precautions if need be. All right. So the hormone replacement therapy, like I said, has to do with replacing those things. But what I say to the women is that it's not for everybody. Okay. And also not everybody needs it. It depends on what symptoms you have, and not just what symptoms you have, but what symptoms you find debilitating. Someone may have hot flushes and hot sweats and is not bothered by it. I mean, like back home, I remember moms, grandmas, sweating and all that, but they moved on with their life. They couldn't be bothered. They just,
went into the hot kitchen.
Yes,
to cook.
Life goes on. But you have women that they have it and it's the end of the world, literally the end of the world. You have to save them or they will fuck their husband at night. Okay. Oh. So it varies what bothers you the most. So what my question to the woman would be, so what are your symptoms? I'm not enjoying sex anymore. Why is that? I feel so dry down there. It's uncomfortable and it just puts me off. Okay. Anything else? What about the hot flushes? I get the hot flushes. They last just a few seconds. I'm not bothered by them. Can you see now? She's not bothered about that one, but the other one has an effect on her life. Okay. So for this lady now, she would not be a good candidate for HRT. She'll be a good candidate for something that's called topical HRT, which is like the estrogen cream or gel that she just puts in her vagina. And that would be it. Problem solved. Okay. Yeah.
So this HRT depends on each person.
Yes. It has to be what's called an informed decision. The lady needs to know what the symptoms are, what's bothering her the most, because this lady having this vaginal dryness, you give her the HRT tablets, it may make little or no difference whatsoever down there. So why does she need that? Why do you need to put her through that? So you need to find out what is it you want to achieve from the treatment. So if the other person
you recommend,
if the other person says, oh, the problem is the sweats, and truly the sweats you see them sweating, their armpits are soaked and this thing, and then you now ask, doctor, I don't really want to go on HRT. I've heard so many nasty things about it. I'm not sure, but I just can't cope with this sweats. There's medication for that. So you can treat that in isolation. Okay.
Okay.
Or you have the women who unfortunately have it all. They have the sweats, they have the insomnia, they can't sleep at night, they have the joint pains.
I understand some people even break out.
Yeah, it's a hard time. And if you have more than 2 symptoms, yes, then maybe might be worth considering HRT. You see what I mean? And then HRT, remember, is hormone replacement. You also have to be careful because not everybody can have it. If you have a past history or family history of conditions like breast cancer is a no-no.
Wow.
It's a no-no, yes. So even though HRT can be beneficial, it also carries its own risks. So it's not safe if you've had breast cancer. You know, if you've had breast cancer and you're suffering from these symptoms, you have to have a chat with your doctor and see if you can have alternatives. Like I said, see if you can have symptomatic treatment. See if your symptoms are that debilitating, because if you can live with it and hopefully you're one of those women that will have it just for a year or so, then you can ride it out. But if you can't ride it out, we can talk through, you know, medication, things that you can try. The mood swings, the anxiety and all that. If you can't have HRT, you can have other treatments. There's mood stabilizers, medication you can go on, antidepressants. You can go and see a psychotherapist. You can have psychotherapy to learn psychological ways of managing the anxiety, the poor sleep, the mood swings, the depression. Okay. So don't feel that if you can't have HRT is the end of the road for you. It isn't. There's other help, you know, other means of support out there.
Okay. May we not have an all-encompassing symptom?
We'll just have to see how it goes. The HRT can be helpful, not just for those. You know, the estrogen, that hormone, even apart from it being the feminine, what makes us women, it also it protects us, you know, it gives us strong bones. That's why once women go to the menopause, it looks as if they're bending over, they're stooped over, their bones, their
arthritis.
They could fall over and break a bone, you know. So osteoporosis, the softening of the bones, the HRT might help with that. Even if you can't go on HRT, maybe have a vitamin D supplements. Make sure you go on something that will give you stronger bones. It also helps protect heart problems. You know, there are lots of protective effects of that estrogen. So when it starts, the levels start falling in our system, it's not surprising the effects that come out of it. However, if you can't have HRT, there are HRT alternatives. Okay. The thing is that even before all these tablets came out and all these medicines we take, they come from herbs.
Vegetables.
Yes. So even all these things, there are things out there that are similar. In the UK we have a herbal store, something called Holland and Barrett's. They're fantastic. You just go there and they'll have a herbal equivalent to every medication, any medication you can think of. So lots of women who can't go on HRT or who do not want to go on HRT, there are things out there that they can have. Even if you go to the chemist, there are special multivitamins, primrose oils, black cohosh, things like that that can also give the similar benefits of HRT if you cannot have HRT. I don't know what it is like in other countries, but I'm sure there's no harm in asking. You can ask your moms what they tried with their grandmom, you know, things that they used. There's some herbs, some spices that they
could have just been showering 3 times a day.
Who knows, you know? So even all these things, there are all these multivitamins, supplements, there are lots of them out there that can give you similar, okay? So it's not a complete loss. But with the HRT, if you're more than 45 years old, and like I said, you're perimenopause or you're still having periods, even though they may not be regular, they'll have to give you a certain type of HRT that will be like you're having a cycle. So you'll be having it and you'll still be having a period like that until a certain time.
But a fake period be that now.
Even the period you get with going on the pill is a fake period. Okay, but it's like I said, it gives you that psychological, you know, whatever. Yeah. But if
like yesterday I was in the pharmacy and I cited one medication, they called it MENOPAUSE.
Okay.
I didn't need anybody to tell me what it was for, but I just eyed it and I went my way. I said to myself, I made a mental note that, okay, when the time comes, maybe I'll come back and look for this.
Yeah, have a look at it. Read the small print. See what is underneath it. Is it a hormonal medication or is it a supplement?
I think it's a supplement. It's from all these people that make well woman.
Exactly. yeah, there's no harm in trying them, but just make sure that it goes well with whatever other medication you're taking already. And then for those that have already gone through the menopause, like I said, your last period was more than 12 months ago, then there's a different type of HRT that they'll give you. Okay, and then it comes with, there's tablets, there are gels, there are patches that you can put on your skin. If for some reason you've had a hysterectomy, you don't have a womb anymore, then you have a different type. They'll give you just the estrogen.
So even taking out the womb doesn't make you escape from these menopausal symptoms.
The thing is that the hormones are produced from the ovaries. So if your womb was taken out and your ovaries were left intact, you will still have the benefits of the hormones. Okay.
Right.
But if you had surgery and your womb was taken out and your ovaries are taken out, that is automatic menopause. And if you're very young,
would you have the symptoms?
Yes, you would have, and they would have to put you on HRT straight away.
Because I would have said, okay, let's take out the thing, then we go on the cruise.
The problem is not the womb and the periods. The problem is these symptoms that are arising because you're not having those hormones.
I get.
Okay, so that's the thing. And then you could still have your womb taken out and have no periods, but you're still having the benefits of the hormones
being there. Okay.
But the only difficulty with that is that it's going to be difficult to now say exactly when you've gone through the menopause, because you've not had a period. There's no way to now tell when your last
because it was fast-tracked.
Yeah, exactly. The womb was taken out. You're still all right, but suddenly you're having hot flushes, this. So you know how I said the difference between peri-menopause and menopause itself, it now becomes difficult. But this lady will benefit from having a chat with the doctor and then seeing if she needs to go on any of these treatments I've mentioned. Like I said, which one is bothering her the most? Sometimes just having a chat and knowing that this is this is that, and they're like, fine, I'm happy to wait, live through it. It's like I said, it's something you have to expect. You don't let it come as a shock to you. Don't
expect it to be like the other person's own.
Yes, everyone is unique. Just because Mrs. A is having a hard time of it doesn't mean that Mrs. B will. Okay. And then even if you're having a hard time like Mrs. A, you can do something about it. Mrs. A may not want to do something about it, but you can do something about it. It can make a whole lot of difference to your quality of life.
Okay. Just like some of us would opt for epidural, and then some people would just walk into the to the labor ward and come out.
And just have it. I know some will labor for 18 hours and some will labor for just 2 hours.
Okay. Izuchi, can you hear me? You said you're a witness to this hot flush.
Yeah, I was going to ask Izuchi that when we're done asking Fiola the questions. I was going to take Izuchi up on that so that she'll tell us how she dealt with it. But I wanted Fiola to take the last question. So, and the question is, having gotten this information and enlightenment, how can women cope with all that comes with menopause?
Yeah, so I've already said a lot of it. Like I said, number one, expect it. If once you're in your 40s, expect it. You're not going to be the only woman that won't go through menopause. Every one of us will go through it. When it comes, is $1 million question, but expect it, work towards it. Don't let it come as a shock. Embrace it when it comes, okay? Deal with it, celebrate it, okay? It's just like when a girl has her first period, it's a big deal in the family. Oh, you're a woman now, whatever. Yes. So this is now the last one. It doesn't mean the end of the world. It's just the end of a certain phase of your life. So celebrate it, because you're done worrying about certain things. You're done worrying about getting pregnant. You're done about, then celebrate this new phase of your life, a certain freedom, just look forward to it, enjoy it. Okay. Another important thing is don't deal with it alone. Involve your husband, involve your partner, involve your boyfriend, whoever it is. It doesn't have to be a journey you have to take by yourself. Okay, it takes two. They should be with you during this time. They should be empathetic. They should be sympathetic. They should be supportive. If you are sweating and you're opening the windows, they shouldn't file for divorce because they want you to die of cold. They should be understanding, okay? Oh, honey, what can I do to help? Do you want the air conditioning on? Should I wear an
Pour me water.
Yeah, pour her water. That will help. Fan her. You know, help her. Take her to the doctor if it's too much. If she's suddenly crying, having a meltdown for no reason, don't go and just give her space. You know, give her ice cream if she's the kind of person that needs ice cream. You know,
that again.
know what I mean? Yeah, right. It will end one day. Okay, but be supportive. You know, if she's shouting for no reason or whatever, you know, don't make things worse. Don't see that she's having a moment and you come and Dad, you think that is the best time to tell her, so what happened? Why didn't you cook soup today? You know, it's not worth it. All right, it's something you all have to do together. And then, you know, don't be too hard on yourself. Don't be brave. Don't say, oh, my mother did not have epidural when she was having a baby. Why should I must do it myself. My dear, people are different. Because your mom didn't have her child, it doesn't mean you shouldn't have her child. If you need it.
And maybe she didn't have access to it, or she didn't know what it was.
It doesn't make you less of a woman that you're going on her child. And people don't have to know either. Okay, so you don't have to broadcast the world. Go talk to your doctor, talk to people, get advice. All right. So, and then, like I said, consider what is bothering you the most. Don't be shy to say to the doctor or to your husband that the symptom that's bothering me the most is the vaginal dryness. Don't be ashamed. Or the symptom that's bothering me the most is the sweating. You need to be open-minded, say what is bothering you so you can get the right help for that. Some women don't want to tell the doctor it's actually the vaginal dryness that's bothering them the most, and they end up having the HRT, which, like I said, may do nothing for the vaginal dryness. Yeah. Okay. So be honest about it, and like I said, celebrate it.
Okay. So thank you, Fio, for elaborating on those. You made it look like a walk in the park.
It's not.
I hope that by the time it comes close to home and I start bombarding you with messages.
It's not. Oh, well. I hope I did not play it down that much. It's not a walk in the park at all, but it's doable.
Yes. At least you made it, you demystified it, and I don't want to say I'm looking forward to it, no, because but at least I am not as scared as I would be ordinarily, because, you know, fear of the unknown is something of its own. Correct. But when you have an idea of something, at least, okay, fine, you're not going to go there head on, but if it comes, you're able to take it in your stride and go through the motions and all that. So I don't know if anybody in the audience has questions for her, but before then, Izuchi said she is a living proof of what hot flushes are and that she dealt with it. I would really want to hear how she dealt with it, because that one, I won't tell you lies, it bothers me. I think about it and I'm like, how would I
dreading it?
Yes, I think that's what I dread most. I'm not even thinking about any other symptom, but and once they talk about menopause, that's the only place my mind goes to.
The hot flushes.
Mm-hmm. Yeah. As if there are not other things, but I just can't imagine, because if you look at my
some of us are not women. Can somebody break down what hot flushes mean for us, please?
So, hot flush means, you know, the blood vessels that supply, you know, that supply the skin. Suddenly they open up. So, you know, just like literally, you know, when you have a tap and you open it on medium and then suddenly you put it on maximum and the water just surges. So just imagine a surge of blood to your face, and suddenly your face is hot. You know, if the lady is light skinned, you see her cheeks just go red. It's like on fire, and it can be very uncomfortable.
And she becomes very sweaty.
Right? That comes with menopause.
Yes.
Okay, thanks.
You know why I dread that is I don't do well with hot weather.
Yeah.
3/4 of the, in fact, all my clothes, I don't have clothes with sleeves. You know, so I can't imagine having that as my major symptom. I just don't want it, honestly.
I mean, God in his infinite mercy, those hot flushes are not 247. Okay, Izuchi will
okay,
clarify.
it comes there. There are
yes,
episodes.
You can just be in the middle of something and it can last a few seconds, a few minutes, and it goes away. What is unfortunate about
tomorrow.
it is that what is unfortunate is that it's unexpected. You can't time it. You can't tell when it will come on.
You can control it.
Exactly.
So Izu, hey, good. I'm happy to hear your voice.
So
Biko, how did you deal with it?
I have a question.
Versin, Biko, hold on. Let Izuchi answer, then you can ask your question. Izuchi says she dealt with it. So
Yeah.
when did yours start, if I may ask?
It started about 2 or 3 years ago.
Chinekele.
Yeah, because I had fibroids, and it was a kind of complex one. My periods were coming heavy, and in fact, I wouldn't even go into that one. So I had to go to hospital, and to the extent that I'm now down, I'm a waiting list for hysterectomy. Yeah. So because of the symptoms I was experiencing, they had to put me on medication called Prostab. I'm sure like you know Prostab. They also use it for treating prostates.
Yeah, it's a hormonal,
Men.
it's an analog. Yeah.
Yeah, it's an injection I have to take every 3 months. So, but now they've changed it to like every month.
Okay.
So that medication made me menopausal. It has to make you menopausal.
Yes.
So
yes.
it comes
to treat endometriosis as well.
Exactly, yes. So it now made me to experience all these symptoms, and it comes double because it's induced menopause. So it's not natural. So you can imagine.
So you had the full blast of menopause.
I had a full blast of it, especially at night. Yes. It's worse at night when you're sleeping. Yeah. I had to sleep in a different room from my husband's because I have to have the fan on, or I have to have the windows. Sometimes I'm just talking, my body is dry, and then I can feel it coming. Sometimes I get my children or even my husband, put your hand on my chest, put your hand, the thing is coming like water, it's coming, and then all of a sudden it breaks out. It's, like you can feel the wetness. Yeah, you can feel the wetness. Or probably you're lacing your shoes and the blood rushes to your head, in the middle of work. It doesn't, give you time. So I kept dealing with it. I went to the hospital. The doctor said, okay, let's see how it goes, because he doesn't want to give me any reverse medication because of my treatment. So because I had other complications. So when it continued, I had to go on Primrose, evening Primrose, which was helping.
Yes.
I can't do without it.
Yeah.
And then later, to my greatest surprise, there's this medication that men take for their sexual health. It's called maca extract from Holland and Barrett.
Yeah, all those supplements, yes.
Yeah, but this one is maca.
Remedies.
This is maca for sexual health. So they gave it to me, and instantly I stopped experiencing that hot flushes. Instantly.
Yeah. Is it, sorry to cut in. So this is the point I was trying to make, that there are other alternatives, akin to HRT. So you see, Izuchi did not have to go on HRT, and she was concerned about a particular symptom, and she has dealt with it. You see, Izu, you're just a testament.
Yeah, but I've stopped taking all that now, because I've stopped taking the injection because it was doing other things as well. It was shrinking my fibers, but it was doing something else to my body.
Yes.
Which I'm not discussing tonight, but but the maca really worked. So for those of them that are experiencing hot flushes, maybe they can try it.
That's a treatment option.
Yeah, like you said,
everybody is amazing.
Yeah.
So the evening Primrose does not stop hot flushes?
It manages it.
It helps.
It helps a lot, especially with your mood, especially with your mood.
You've gone off audio.
She must have muted herself mistakenly.
By accident. Okay.
Is you on mute or you want to hear the remainder? What really happened? Or she doesn't know she's muted? Okay, before she comes back, Benson, please go ahead.
I have just a simple question.
What makes you think it's simple?
Yeah, because I know it's simple.
I was trying to end the call and it disrupted the whole thing.
Oh, okay. Sorry.
Yeah, sorry.
So you want to go ahead, Izu. So you said the evening primrose helps.
Yeah, I said it manages it. It doesn't help it completely. Like Fiola said, everybody is different. What works for me may not work for you. But evening primrose is very, very popular.
I've heard people talk about it a lot. They said it's good for the skin. It helps you sleep better.
It does.
Oh, really?
It does.
So it could also help. It could also help with moisturizing down there too, Abby.
I don't know about that. But I think the maca does. The maca extract, I think it does what you're asking, but the evening one, it does, it plays a part making your body glow and all that. It helps you. It works alongside the rose hips. Like if you have a wound, it helps you.
The person else called her back.
I'm telling you, Benson Biko, go ahead. Oh, okay. This person is bent on making this call. Benson, go ahead, please.
So Benson, go ahead. He's my son. He's at the train station.
Oh, yeah.
Yeah.
Okay. Izu, thank you so much. Okay.
Better go and pick him up.
Go and pick him, Biko.
All right then. Thank you.
Thank you so much.
This menopause, when we talk with the listening to, does it have anything to do with weight gain?
Not directly. Not directly. The thing about menopause is that what adds to weight gain, okay, is simple. If you are eating more and expending less, you will put on weight. So directly, no. But indirectly, in the sense that some women going through this time may feel low, depressed. They might feel less active or be less active because their body is aching, their joints are hurting, they're not sleeping well. So they're not out and about like they used to. They're not as active as they used to. And then they may comfort eat, so eat more than they would usually. So indirectly, they would start putting on weight. I don't know if that makes sense.
Okay.
Yeah, but directly, not likely.
And it's also possible that some of those medications might make them add weight, right?
Well, lots of people claim they do, but the research is very poor. It's very sparse on that.
Because I always hear about people saying, oh, the hormonal injection blew me up.
Yes, I was going, the only exception to that is the hormonal injection, and that's correct. That's because when they have the injections, it has what's called, it causes increased hunger. It's like you have the urge to eat. It reduces your sense of satiety. So when you eat, you feel that irrigible, you want to eat more. So the hormone injection can do that. But the way to curtail it is to let the woman know this is not everybody gets that as a side effect. Just like when you have paracetamol, not everybody has side effects with paracetamol. Not every woman will have that effect with that injection. But it is worth letting the woman know that this is likely to happen, and to counteract that, be a bit more cautious. At the end of the day, weight gain has to do with self-control. So if the woman is able to control and eat only what she needs to eat when she needs to eat, she won't have a problem with weight.
Shella, I heard something, the positive of menopause is it makes a better relationship. There's no worry about getting pregnant or telling your husband you're not safe. It's a free world.
Correct. I said it. I said it when I said it's a different phase. It's the start of a new phase of your life. A certain freedom.
I'm here. I am by
it
the
will not protect. It will not protect you against STIs, Former. So still,
and neither will, if you are having the dryness, it will not be sweet.
Yeah. So I mean, there are so many ways to go about it. You can get lubricants, get KY jelly.
Yeah. Okay. Thank you. Useful information.
Okay, one of my requests to Oche Kitchen is that since there is male menopause, maybe your next topic should be the male menopause.
Sure, we will do that. Yeah, Benson, that will be next topic.
Sorry, are you experiencing some symptoms? With the lag, is there anyone that's bothering you?
No, Benson just approached the 5th floor, so he wants to play safe.
He approached the what?
The 5th floor.
Oh, really? Congratulations, you've tried. It's not easy.
At all. So does anyone else?
I'm above the fifth floor with almost 2 years.
Almost is not too much. It's still early.
You should have given us your insight. I don't know how old you, whether you have a wife, whether there's a missus somewhere or a girlfriend that is considering your 5th floor status. Maybe your wife would have gone through what we're talking about. It would have been nice to have an insight on how it felt to be on the other side. How did you support her, or how are you supporting her?
She never reached.
Well, the baby.
For those of us on the 4th floor, how many of us have experienced it?
Oh,
like I said, you are definitely in the peri.
So he might not, her peri might not have any symptoms now. So
correct. Yeah, some people don't have anything at all. You're absolutely right.
Yeah, but like I know, I think this thing varies from persons to person.
Correct.
Because I know that you see some women at the age of 55, at the age of 60, still giving birth.
Yeah. Like Abacha's wife had her last child at 50 when they were, her last child, she had her at 50. Then her husband was still the president.
Yeah, so she definitely, her last period definitely wasn't more than 12 months prior.
I don't know for them how they did it. That's not my business.
So which is it varies from person to person.
Yeah, it's just like pregnancy. For the 3 pregnancies I had, I never threw up, not even for 1 day. Meanwhile, some people, it is when they start throwing up and down that they would even realize they are pregnant.
Even with pregnancies, you can have 3 children and the 3 pregnancies were completely different.
Not you can have. My 3 pregnancies were different.
Yeah, so you're right, Benson. It varies from woman to woman. That's why I said you should see what your own throws at you and see how it goes.
At the end of the day,
thank you very much. It's been very informative. Thank you.
Mom, are you pursuing us from the show?
No. I just want to say my take. I'm going into the boat, so I thought
you're going where?
I'm holding you.
You're going to watch a show.
No, she's going on a cruise.
If you were happy, man.
She's going on a cruise. Okay, so I wanted to ask, does any other person have any question for Phil before we round up the show? Okay. In the absence of that, I will give a vote of thank you.
Vote thank you.
Phil, thank you so much for coming. It's been very informative and interactive and very, very, like I said, not necessarily like a walk in the park, but it was a relaxing session because the way you handled it, at least we know that, yes, this is what human beings go through and we're looking forward to it, quote, quote. Okay, so we shall be having another interesting topic next week, Saturday, and we hope to have your audience. I don't know, I may or may not be here.
What's the topic next week?
Next week, Saturday. Hang on, let me check. I think I have.
Why is Pam Pam not here today now? She on holiday.
Pam Pam is on a roll this month.
Oh,
She'll be fully here next month. So, oh, next week Saturday is religion versus tradition.
All right.
And Mama is going to handle that. Real Wahala. You know, Mama likes to play the devil's advocate.
Who is going to handle it?
Wahala.
It's Mama's show. Today's one was my show.
Okay.
So I chose this menopause as a theme. So she's gonna handle that religion versus tradition. We'll see how it works. Then Mama's own on the 12th is explosive. Secret second home.
All right.
So we'll see how that goes. Okay. So thanks everyone. We're gonna go offline now for anybody who wants to stay on overtime, but I doubt. So I'll end the show now, and thankfully we're ending on a good note. Thank you again, Fio, and thank you to the audience.
My pleasure.
We hope to see you guys next week.
Fio, thank you so much, Fio.
You're welcome, Ben.
Yeah, so I'm going to give I'm going to name my daughter Fiola.
Oh, let me be her godmother. You hear?
Okay.
Okay, so bye guys. I'll go
offline
now. We can still banter a bit. Night night. Night. Mama.
I thought I'm in a meeting.